Hello, everybody, and thank you so much for joining us today. My name is Kristen Pruski, and I have the privilege of being the Vice President of Sibley Memorial Hospital Foundation. Today, I'm joined by three amazing colleagues, Dr. Hassan Zia, Dr. Jennifer Abley, and Dr. Laura Hendricks Jackson, so that we can share with you, our generous supporters, some updates on the current state of COVID within the community more broadly, and also at Sibley. I want to just start with a few quick housekeeping items. This meeting is being recorded and will be available post-event emailed to you. After this session, you'll also get a pop-up reminder of a quick 2 or 3 question survey. We would really love your feedback on what types of virtual webinar events would be helpful to you and your family in the coming months. All attendees are muted, and you can submit your questions via the Q&A feature at the bottom of the screen. Without further ado, I'm so pleased to introduce you again, hopefully for most of you, to Dr. Hassan Zia, our President and CEO. Please join us, Dr. Zia.
Great, thank you so much, Kristen, and thank you to everyone who's taken the time to join us this afternoon to hear a little bit about all the great things we've been able to do with your support, but also some of the challenges that we're facing and that our community is continuing to face as well. Kristen, can we go to the next slide?
Absolutely, and you want to start your video, Dr. Zia, so everybody can see your hands.
So it tells me I can't start my video until you approve it, Kristen.
Oh, goodness gracious. You think I'll work on that in the background.
All right. All right.
Should be good to go, Dr. Zia.
All right, perfect, thank you. So, I think we've talked before about just the amazing support we've received from our community over the last 18 months. Over 700 individual donations to Sibley to help support some of the work we're doing and how we're supporting our workforce across this pandemic. That has really enabled us to do so much. Over 40,000 meals have been distributed to our workforce over the course of that time, and very much in due to the support that we've received from all of you. Food insecurity had become a big issue with many of our staff, and that was something that we were able to help with, and nearly 2,000 bags of groceries were distributed to our staff in times they needed that most. We've been able to do things like help with transportation when public transportation was limited, and so there's so much we've been able to do to support our workforce directly as a result of the support we've received from all of you and from our community. You can go to the next slide, Kristen. I did want to highlight some of the great things that are going on outside of our COVID response. So we did send out some communications to our community around the recently released U.S. News and World Report rankings. Again, Sibley was recognized as one of the top performing hospitals in our region. There were some very specific programs that were also recognized as high quality programs. And U.S. News and World Report is a fairly high bar. All of these programs, as I look across, many of them have been supported through philanthropy. You think about the work that we've been able to do in orthopedics and the Gildenhorn Institute, the work that we've been able to do in surgery with supporting Dr. Paul and some of our other surgeons. And so really just wanted to, again, thank all of you, thank our community, and just recognize the great work that has very much been enabled through your support and through philanthropy at Sibley. I did want to talk a little bit about where we are as a community with COVID. So this is a graph that we've all looked at together at previous events. This is looking at essentially the prevalence of COVID in our community. This is the daily case rate per 100,000 residents in the District of Columbia. And we see a very clear 3 areas of spikes on this graph that correspond really to the first surge that we experienced in the spring of 2020, the second surge that we experienced in the winter months, November, December of 20, and into January, February of 21, and then really had an amazing, response to the vaccinations and to all of the other efforts with a very rapid decline in the incidence, almost to a case rate of between 1 and 2 for a period of time. And unfortunately, as we all see in the news and as we're all experiencing, we have seen that daily case rate go up fairly significantly beginning in the early July timeframe. And we're at a rate now of new cases on a daily basis that approaches, really where we were at towards the end of the second surge in the winter. So it's something we're keeping a very close eye on. But if you want to go to the next slide, I do think there are some good data and some indicators that show us that perhaps this is not going to be similar to the first and second surges that we experienced in COVID. In both of those instances, we saw a very clear trend up in hospitalizations, very temporally related to the increase in the daily case rate. And while we have seen an uptick in hospitalized patients over the last few weeks, and really over the last 4 weeks, it hasn't been as sharp of an incline as it was with the previous surges. And this is looking at the total number of patients admitted across all District of Columbia hospitals in the red line, and then the total number of COVID patients admitted across all DC hospitals with the blue line at the bottom. There was a peak in hospitalizations in DC in the last week of August, and it peaked at about 116 patients. Just to put that in perspective, during the first and second surge, there were upwards of 400 to 500 patients admitted across the DC healthcare facilities. And so not nearly the magnitude, and hopefully actually some signs that maybe hospitalizations are starting to trend down. At Sibley, we also experienced a peak the last week, really the third and fourth weeks of August. We had up to 11 patients admitted at one point. We're down to about 6 patients now, and hopefully we'll continue to see that number either trend down or stabilize. Want to go to the next slide, Kristen? This is some data that I thought was really interesting to share, and it's available publicly on the DC Health COVID data website. This is really looking at breakthrough cases in vaccinated individuals. The two numbers at the top, so the 47.9 is the daily case rate in DC residents that are not fully vaccinated. And that's obviously a much higher number. And the lower number on the left-hand side is a 7-day average of cases in those that are fully vaccinated. So just the new number of cases in fully vaccinated individuals is significantly less. The bottom, the data that you see on the bottom is breakthrough cases by the different types of vaccines, and really all 3 vaccines have been very effective, and certainly the overall incidence is lower in vaccinated DC residents. If you want to go to the next slide, I think this is an even more important set of data. And it's a very busy slide. And again, I would encourage you to visit the DC Health website and look under the COVID-19 data tab, because there's a lot of great information available there. But what this is really looking at is hospitalizations and then mortality in the vaccinated breakthrough cases. And again, compared to the unvaccinated population, there's a very, very low incidence of hospitalization. So if you are fully vaccinated and you test positive for COVID, certainly the severity of illness is much less than an unvaccinated population. And then there are only a total of 7 mortalities going back to the month of January in patients that were fully vaccinated across the District of Columbia. So I think just, again, very compelling data, and data that is consistent with what we've heard across our nation in terms of the protection afforded by the 3 vaccines. So hopefully some encouraging news, and something that may bend the curve on the experience we've had with COVID to date. All right, so with that, I will turn it over to Dr. Jen Abley, who will talk a little bit more about some of the issues we just discussed.
Good afternoon, everyone. I get a lot of questions about third doses and boosters, so I'm just going to take a couple of moments to address some of the questions that I receive. You know, as Dr. Zia was mentioning, the vaccine does a very nice job of preventing hospitalization and death. What we have found over time, particularly with the Delta variant, is that the vaccine effectiveness to prevent infection is waning a bit. And we see this even more pronounced in our older population, and maybe because they got the vaccine a little bit earlier. So whereas even if you've been fully vaccinated and with Delta, you might be more likely to get infected, you are still less likely to be hospitalized or die from COVID, having been fully vaccinated. So that comes to the question about booster shots and will they be helpful? First, I want to talk about the difference between something called a third dose and a booster shot. Many times on the news, these terms are used interchangeably. There's a subset of patients who are immunocompromised. They might be cancer patients, they might be transplant patients. Those patients, it's been determined that they don't always mount a great immune response to the 2 doses of the vaccine. So currently we are approved and authorized within the country to administer a third dose of the primary series to these patients so that they get an adequate, or we hope to get an adequate immune response. We are already administering those doses across the country. A lot of the news is also focused on what we're calling booster doses or booster shots. Those are for people who it's been a while since they received the primary vaccine series, so our immunity may be waning a bit, and this will boost us back up. One thing to remember is that when we receive vaccine, we get vaccine from the government. We sign an agreement with the government to abide by their conditions and regulations and guidelines. They have not approved us to administer booster doses yet. As you've seen on the news, the goal is to start administering booster doses around September 20th. And that's the latest date that I've heard. I know that they're hoping to move that up a little bit and start earlier. So at this point in time, booster doses are not available, but we're planning for September 20th as across the country as when those will be available. In addition, I just want to take a moment to talk about, what can you do to keep yourself safe? I just continue to reiterate to patients, masking indoors when you're around non-household members, washing your hands frequently, staying home if you don't feel well, not chalking up a runny nose just to a cold, but really considering it might be something else and not exposing other people. It'll be interesting to see what happens to handshaking at the end of this, because it's no offense, I just don't shake hands anymore when I greet people. Using a paper towel to open the bathroom door, avoid touching your face. All of those things can help reduce the spread of germs. In addition, obviously, avoiding large crowds. It's a little bit unfortunate, I think in the summertime, we all took a big sigh of relief and thought we'd gotten over the hump. And so reverting back to some stricter processes is disappointing to all of us, but important to keep us safe. And on that note, talking about safety, I'm going to turn it over to Dr. Laura Hendricks Jackson, who's our Chief Nursing Officer and our Vice President of Patient Care Services. And she's going to talk about what we're doing as a hospital to keep you safe when you come.
Thank you. I was having a little bit of difficulty unmuting there, so I appreciate that introduction, Dr. Abley. And good afternoon, everyone. I wanted to take just a few minutes to talk about some of the things we've done at the hospital to really make sure that the environment is safe for you and our patients in our community. And not just at Sibley, but as a health system, we have required universal masking that went into place at the end of July. And that essentially requires all of our personnel to wear a surgical mask or procedural face mask in all areas of our building. You'll also find that as we provide patient care, the staff will have a face mask on and a face shield when they are unable to maintain that 6 feet distance. And so we take that very seriously. Our staff take it seriously. It is a comfort measure for our visitors and our patients, and we consistently ensure that that is happening throughout the hospital in our organization. Next slide, please. We thought it was important as well to talk about something very important to our patients and our community, visitation. And so we have a standardized visitation protocol that we follow. And this protocol is based on community spread. There are several levels to the protocol. And those levels associate how many care partners we are able to accommodate at that particular time based on community spread. At this time, we are on yellow, which is a medium risk for care partners visitation. And we went on yellow the early part of August, and we've been able to maintain yellow for about a month now. And so we recognize having a care partner or a visitor during our patient stay is a priority and very important. And so we take the evaluation of visitations very carefully. And essentially what yellow means for our inpatient setting is that we can allow and support one care partner at the bedside, and we can rotate up to 4 care partners at one time during the same day during our visitation hours. The very exact same thing for both our emergency departments and our outpatient care areas. And so with the exception of our pediatric area where we would allow up to 2 adult care partners. And so you can always find out our visitation level on our website. It's really important to us to make sure that that level of communication reaches our community and our patients and also our providers and staff. Next slide, please. We have, and I know Dr. Abley talked a little bit about the vaccination requirements, but we have as a health system required that all of our personnel be fully vaccinated by September 1st. And this policy essentially applies to all personnel, whether you're students or staff or volunteers or physicians or providers. This is really important, and it's an important approach that the health system and Sibley has taken to make sure that our staff are vaccinated and providing care in the safest possible manner. There are a few exceptions related to medical and religious reasons, and so it was important for us to share that. And then finally, on the very next slide, this is very near and dear to my heart, and I just want to take the moment to say sincerely thank you for your philanthropic support and your donations, your care, your concerns, your cards, your letters, your notes. It means a lot to our staff and our frontline staff and our employees. And this is just a sample of some of the things we've been able to do to help enhance resiliency and prevent burnout for our staff. And it goes from providing meals for our staff to really providing relaxation and stress reduction support, to providing psychological wellness support for our staff, team building opportunities, enhancement with education and certification. For those staff that may be experiencing financial hardship, it's through your philanthropic donations and dollars that we can provide these resources to our staff so that they can continue to provide excellent care and show up and be available for our patients and the community. And so I thank you sincerely on behalf of our hospital, our executive team, and our staff for your generosity. We really, really appreciate it. And having said that, I believe we're at a place where we can answer any questions that you might have. And I think there's a Q&A going on here, and Kristen, you'll facilitate or moderate that.
I sure will, Laura. Thanks so much. Just as a reminder, on the bottom of your screen, you'll see a Q&A feature, which has two little talking boxes. You can enter any questions there. We'll do our best to enter. I'm going to start with a couple questions that were submitted ahead of time, letting folks put their questions in. Going to start off with Dr. Zia. Are you giving any monoclonal antibody treatments? And if so, what's the process to getting that done at Sibley? Oh, let's see if we can get you unmuted here.
Oh, perfect. You have a lot of control today, Kristen.
Who knew? I'm not in charge of setting up the webinars.
All right. No, that's a good question. So we had started a protocol to be able to infuse monoclonal antibodies really quite some time ago, and we actually do that in our emergency department for outpatients. It does require that a physician that is on our medical staff provide essentially an order or referral for that infusion. But with that, we are able to provide that service, and we do that in our emergency department. So we do have that available for our community.
And can I just clarify that the patients don't come in as emergency department patients? So our infusion center staff perform this function, and they do it through appointment, and they just happen to use space in the emergency department in the morning when it's not occupied, because the emergency department has great airflow and ventilation and is away from our infusion center oncology patients.
Great clarification, Dr. Abley. Dr. Abley, while you're on, can you give us a little bit of an update on if where Sibley oncology patients can get their third dose of the vaccine as they are immunocompromised?
So that's a great question. So, you know, when the vaccines first started to become available, you really couldn't get it in many locations except an acute care hospital or acute care facility, and then slowly at these mass vaccination sites. Now, everyone has done a great job of getting it to retail pharmacies, very widely available at retail pharmacies and at doctors' offices. So right now we are not vaccinating the public anymore. We are focusing our efforts on our acute care activities. And so I can go online right now and get an appointment at a retail pharmacy down the street if I wanted one. And we're encouraging through our oncology providers, they're assisting their patients with access to vaccine. I have gotten the question, as boosters become available, will we restart our vaccine clinic for patients like we did with the mass vaccination in January, February, March timeframe. And we are going to see, I do not think that the retail pharmacies and the doctor's offices are going to be a rate limiting step at this point in time. They've done a really nice job. So at this point, we don't have plans to open back up to patients for immunization purposes. But if for some reason access becomes a rate limiting step, we will certainly reconsider that. I've also gotten a lot of questions about the flu shot. If I can just chime in there.
Please.
People ask a lot, what's going to happen with the flu shot? How much time do I have to wait between a COVID booster and a flu shot? When should I time my flu shot? And so, you know, this is the first year we're doing COVID vaccinations at the same time we're gearing up for flu shots. The CDC has said that there's no reason you can't get your flu shot at the same time you might get a COVID booster shot. And so there's no contraindication to doing that. I think for a lot of people, it's going to be a personal preference. How do you feel after you get the flu shot? And how do you feel after you get the COVID shot? Everybody has very different responses. And I think it's going to be an individual decision.
Thanks for that extra information, Dr. Abley. Laura, we've got a question that reads, I would like to know how the COVID-19 situation has affected Sibley staffing, especially the nursing staff. Have many nurses resigned or retired? And has the impact of vaccination encouraged that?
So thank you so much for that question. And so fortunately at Sibley, we have not had many resignations related to COVID or even retirements related to COVID. As you know, staffing, nurse staffing particularly, is a challenge across the country and has been a challenge pre-COVID. And so we continue to work with our human resources department to remain competitive and recruit and retain our nurses. We have many initiatives that we roll out to make sure that our nurses here at Sibley feel supported as it relates to their practice environment, as it relates to compensation, as it relates to morale and resiliency. And so we've been really fortunate here at Sibley to be able to share that we haven't lost many nurses as it relates to COVID, the COVID pandemic. And so thank you.
Thanks, Laura. I'm not sure, Jen, if you want to take this, or Hassan. Some indoor entertainment venues have started restarting performances inside. They require full vaccination and mask on at all times. Can you comment on the relative safety of our attendance?
And do you want to take that?
Sure. I'm encouraged by places requiring vaccine cards to increase the safety and try to get people back to normalcy while still trying to improve the conditions to lessen the chance of transmission. I don't think that there's a lot of data on this yet. That's the interesting thing about COVID. You know, the Delta variant came out a few months ago, and a lot of our data is pre-Delta variant. So we're really trying to catch up, and a lot of the science and the data is coming out. We're studying it as it's happening. So I can't cite any literature or scientific evidence on this particular part of it, but I do know, that's what we're doing in the hospitals. We are vaccinating and we are masking. And so without a research paper to cite, it will anecdotally improve safety. How much, I can't say.
Thanks. And along that line, the question is, as experts, are you concerned about the virus mutating such that the current vaccines may not provide protection? And also the person said, thanks for all you're doing to help keep us safe and provide reliable information.
And that's the big concern, right? So the Delta variant, these viruses mutate. So it is that virology is fascinating. These viruses mutate very quickly. And once you get a good variant, good as in it does a great job surviving, it's going to become the predominant form. And we saw that in the Delta variant. It's twice as contagious as the other variants. And as it's so widespread, it's going to continue to mutate. And so, yes, there's always that concern. And that's why we're just going to need to keep staying ahead of it. I'm sure that Moderna, Pfizer, and the other companies are already working on the next vaccine that targets different areas of the virus as it has changed and mutated.
Thanks so much. Hassan, could you speak to, somebody wrote in that they've heard that there's been increased wait times in the emergency department. Can you give a little insight into what's going on at our emergency department and maybe emergency departments in the whole region?
Yeah, absolutely. So we have seen our patient volumes coming to the ED increase very significantly, particularly over the last 3 to 4 months. I think that's multifactorial. I think a lot of it is patients that were reluctant to use an ED across the peaks of the pandemic now gaining a level of comfort. I think some of it is related to care that was delayed across the pandemic now presenting at a more acute level, requiring patients to come to the ED. And maybe some of it is also related just to everything that's going on in the community with increased prevalence of COVID once again. But all three of those factors have significantly increased volumes at Sibley Hospital and also at almost every emergency department across our community and across our region and really even nationally. That has absolutely resulted in lengthier wait times for patients, and we've certainly heard that feedback as well. We, in particular at Sibley, are looking at everything we can do to improve that. everything from process improvement, space improvement, increased staffing. We're really pursuing all those different avenues to improve the throughput in the emergency department. But it is really a very challenging time for emergency departments across our region and across our nation right now.
Thank you. We're grateful for the hard work of our ER team. Dr. Abley, does your booster have to be the same type as your first vaccination?
I've gotten this, the preference would be that it is the same type. If for some reason you can't get the same type, it is acceptable to get the other, meaning Moderna, Pfizer. J&J will probably have a booster dose as well. That hasn't been officially announced yet.
Fantastic. And can you explain, does the difference between a third dose and the booster also involve a different dosage of the vaccine?
No, it's the same dose.
It's the same dose, and your third dose is your booster.
The same amount, yes.
Okay, fantastic. Sifting through our questions here a little bit. Somebody here talks about, can you talk a little bit about the current government position that boosters are given at 8 months? I have a parent who's 85 who is fully vaccinated in March, and I'm concerned about the waning immunity and putting my parent at risk. I'm also worrying about being very careful with masking, with the Delta variant and colder weather are coming, and that makes me scared.
So there's been a lot of conversations about what's so magic about 8 months. And why should we wait until September 20th if we think we're going to need to do it? Why not do it now? So I don't know that there is a big body of literature to really support the 8-month mark versus the 6-month mark. They do show things start to change about 6 months. I'm not sure exactly why the specific 8-month.
Great.
And we are going to be beholden to whatever the recommendations are. So for the people who administer the vaccines, as I mentioned before, we signed an agreement that we will abide by, the government recommendations. So if they say we're going to vaccinate at 8 months, then we check and we vaccinate at 8 months.
And that would be consistent for all people who administer vaccines, whether it's retail pharmacy, hospital, any healthcare setting that's delivering vaccine.
Yes.
Great. Somebody asked a specific question here about they had their second Moderna shot in February and they have to travel abroad. Can they get a booster shot in lieu of kind of as a third shot, or is it recommended that they wait generally until the booster eligibility for them is approved?
Did you say get the
they said
third shot as
get the third shot, see if they can try to get the third shot instead of waiting for the booster.
Well, the third shot, the third dose is really for immunocompromised patients who maybe never mounted an appropriate immune response. Right now, we're not yet open to giving the booster shot. Now, I do know that there are people who go in and sign up at CVS for their third shot, and they check the box to say they are immunocompromised and they're eligible, and they might not be. I have certainly heard stories of people doing that so that they can get their booster dose when it's really, they don't qualify for the third dose. And I've seen statistics as people are reporting how many people have gotten immunocompromised people getting the third dose versus people who are going in and working the system to get their booster dose early. That is not according to our guidelines or our recommendations.
Thank you for that clarity. Got one more for you, Dr. Abley. Does Sibley do antibody tests?
So, the District of Columbia does a certain percentage of antibody tests.
Antibody, yeah.
Sequencing, sorry. So
you can answer that one next.
Okay. We don't routinely test people for antibodies in all of these studies that they're doing that are research-based. They're actually doing antibody titers and as part of studies to get our literature out there. We typically just follow the literature guidelines that are done on a population health scale. If for some reason a physician feels that their patient needs an antibody titer completed, our lab does perform that test if they come in with a physician order for it, yes.
Okay, and you want to talk a little bit about what % of COVID tests are DNA sequenced?
Yes, so the public health lab in DC sequences a certain percentage of all of the positive COVID patients to determine what variant is circulating through the community. We're not doing that type of surveillance in our hospital, but that is performed on some of our specimens to help get the vibe of what's going on in our local community.
One last question, unless we get any more coming through. This week has brought the start of a lot of schools coming back into session. Laura and Jenna, I know you're both parents of school-age children, and just wondering if there was anything you wanted to share on tips for parents who have school-age children on what they can do to help keep their families safe. We get a lot from grandparents and parents on, what they can do to help their kids.
Thanks so much, Kristen. And so, a couple of things that we can offer this group, and it's essentially the same thing that we would say to adults, right? So very good hand washing. You can practice social distance. Some schools and some school districts are requiring masking. So to encourage your children to follow the guidelines as it relates to masking. Of course, have conversations about sharing foods and lunch and so forth. I think that's really important. Check in with your children daily. Evaluate them for symptoms, fatigue, any kind of change in feelings or behaviors that may be associated with some of the side effects related to COVID. Remain abreast of the school policies and guidelines and communications coming from the school. I do know that the school system or the school is required to provide notification if a staff or student tests positive. So remain abreast of that and make sure that you're having that kind of communication with your school.
Good practical advice as we start kindergarten next week in our household.
Right, and boy, from a health standpoint, kids need to be back in school. So it's great that we're getting them back in school. They really need it.
Has anybody heard any insights on when we believe under 12 vaccination will be available? I had read an article that it was going to be later in the year.
There are ongoing clinical trials, and in fact, Children's National is a site for clinical trials for children between the ages of 2 and 12. So I think as soon as they have sufficient data, we might be hearing something.
Eagerly await that. Dr. Abley, a little clarification. What does an antibody test mean? Do you still have antibodies? Do you wait for the booster shot?
So the antibody test, so this is actually kind of interesting. So it's testing your blood to see if they can detect any circulating antibodies that will attack and fight the virus. But it's interesting in immunology, you might not always have a high level of circulating antibody, but still may be able to mount a very good response. So it's a little bit unclear as to how to interpret some of these test results. And they're even going further and trying to do these neutralizing antibody tests, but I don't want to get too complicated. Some physicians are using it for transplant patients to try to determine if they are even mounting a response to their vaccine. For people who are not immunocompromised, like I said, we're not really testing for antibodies. What was the second part of that, Kristen?
I think you answered it. Sorry, my question's got
does it guide the booster shot?
Yeah, does it guide the booster shot?
At this point, it would be very challenging to interpret an individual antibody test result if you are not immunocompromised and make a decision on the booster.
Right.
I would go with the public health guidelines that are population based.
And somebody asked a question, will the booster shot be triage to healthcare workers and then those over 65 after the September 20th availability. Will that be kind of timed to the first 2 doses that you got?
It will be, and I've already seen some recommendations from the CDC where they are recommending that the frontline healthcare workers and with the population that's most at risk, the frontline healthcare workers and our older population be prioritized. But I do not think we're going to get the same rush as we did when the vaccine was first introduced, and we are really not limited in our supply right now. And there are so many different avenues for getting the vaccine that I don't think that we'll see the same weight between different groups getting their boosters.
Dr. Zia, this kind of gets to your slide earlier about breakthrough. Are you seeing a pattern of which vaccine does or does not appear to have a higher incidence of breakthrough? You had showed that great slide earlier from DC Health. Can you talk a little bit about that?
Yeah, I mean, I think we've seen that all the vaccines are effective in preventing breakthrough cases, but really more importantly, in preventing severe disease and hospitalization. So I don't think there's one that's clearly better or worse in terms of that. All of them seem to have a high degree of effectiveness.
Great. Without seeing any other questions, I think I'm going to read one that was submitted to kind of end this by one of our attendees that said, not a question, just saying thanks to each of you for taking time for this session. It's comforting to have opportunities to participate in forums with representatives from a hospital where my providers are. Stay safe and well. And I think I can speak on behalf of all of the community as someone who this is my community hospital. We are very grateful to have the 3 of you leading the charge and all of the people on the Sibley team that support this. What a wonderful community treasure we have. And we're grateful for your dedication. We're also grateful to those of you who are joining us today who have made gifts to support these talented team members throughout the hospital. It's truly rewarding when they come up with a challenge or a problem that they can use philanthropic dollars to help solve those problems. And we're very grateful to you. And like we shared before, we will send this recording out to you, and please watch it and share it with your family and friends, and also provide us with feedback on sessions that we can bring to you to keep us all connected, because I wish we could all be together like we were talking about before and how we were excited over the summer. We were hoping to be together physically, but in the interim, please stay safe and be well. Thank you, everybody.